Okay. Good afternoon and a warm welcome to all participants on behalf of Homeopathy Middle East. We are gathered here for a great webinar after a long break and hope to gain maximum knowledge, which is the sole aim of this group. I hand over the platform to Dr. Sita Lakshmi, who is representing the Education Committee of HME and will take over the proceedings for today. Thank you. Dr. Sita, over to you.
Thank you, Dr. Ritu. Good afternoon, doctors. Glad to welcome you all for this webinar. I take this opportunity to welcome Dr. Akshay Banker, a speaker for today's session, and his topic of discussion is homeopathic treatment in cases of vitiligo. Vitiligo is an autoimmune condition, and we see increasing number of cases in this post-COVID era. And Dr. Akshay will share his expertise on this topic with us today. Welcome you, sir. I welcome Dr. Preeti Desai as the moderator of this session. Welcome you, Dr. Preeti. Homeopathic Middle East Group provides a wonderful platform for continuing medical education by regularly organizing monthly webinars with distinguished speakers from all over the world. The topic discussed will help the medical practitioner to sharpen their practical skills, and these webinars are conducted on the third week of every month. We also conduct monthly case discussion on the first week of every month on our WhatsApp group. I kindly request Dr. Preeti to introduce our speaker and take over the session. Thank you. Dr. Preeti, you're muted. Can you unmute yourself and talk?
Hello. Can you hear me?
Yes, Dr.
Thank you.
Now it's fine.
Thank you, Dr. Ritu and Sita. Hello, everyone. Good afternoon, everyone. As a part of our vision to upgrade our knowledge and enrich our experience, today we have Dr. Akshay Banker with us. I have immense pleasure to introduce Dr. Akshay Banker. He is LCEH and MD Homeopath. He is ex-principal and professor of Pachchigar Homeopathic College, Surat, Gujrat. He was also ex-principal and of CN Kothari Homeopathic College, Vyara. He is practicing homeopathy since 1987. He immigrated to Canada in 2010. At present, he is practicing in Toronto at 3 locations. He is also faculty in Ontario College of Homeopathic Medicine since 2010. He is having vast clinical and teaching experience of more than 36 years. I'm also pleased to say that his wife and daughter also are practicing homeopath, Dr. Neena and Dr. Janvi. So I welcome Dr. Akshay and hand over session to Dr. Akshay. Thank you.
Thank you, Dr. Preeti. Thank you, Dr. Sita, for all this. And I don't see the name of the first person. So are you Dr. Preeti? Shruti?
No, for me?
Dr.
Yes.
Ritu and Sita.
Dr. Ritu.
Dr. Ritu, okay, because on your screen only HME is seen.
Yeah, because
So
I'm representing HME. So that is
Okay.
how it's coming as HME, but I'm Dr. Ritu. Thank you, sir.
Okay. Thank you very much. So thank you, Homeopathy Middle East. I was asking Preeti, what is the name of the group that because in the flyer or whatever you made, there was no name of the association or group. So she said we just call it Homeopathy Middle East. So it is good.
That is the name of our. It's not an association. It's a group of homeopaths here. So which we represent homeopathy in Middle East.
Nice. So thank you everybody for being here. And thank you for keeping the flag of homeopathy high in Middle East. it is very essential that these kinds of activities are constantly done so that we can all upgrade ourselves, have new knowledge based on different disease conditions, and thus help our patients get better. So let me start. I will start the share screen. Let me hide the floating meeting controls. Okay, the topic for today is vitiligo, also called leukoderma, and its homeopathic treatment. The purpose or aim of this lecture for me is to help others believe what I have strongly believed, that homeopathy is helpful in so-called incurable cases. Because vitiligo, normally, whenever I get these patients over here, they have already been to dermatologists and have it diagnosed. And usually, the dermatologist would say that there is no cure for vitiligo, and so you will only have to live with it for the rest of your life. This is a very common sentence that I hear. Another purpose of is to share what I know with everybody, to encourage others to share what they know. This is very important because there are homeopaths around us who are quite knowledgeable and they have a lot of experience, but somehow, due to some reasons, they fail to share their knowledge. And that is a big disadvantage to homeopathy. So anybody or everybody should share, and that is very important. We all have our own resources from which we learn. Some are common and some are different. So sharing brings all these resources in one pool of knowledge. Definition. Vitiligo is a condition in which skin loses melanin, the pigment that determines the color of skin, hair, and eyes. It is also called leukoderma. Vitiligo occurs when the cells that produce melanin die or no longer form melanin, causing slowly enlarging white patches of irregular shapes to appear on skin. According to modern medicine, there is no cure for vitiligo. Vitiligo is believed to be an autoimmune disorder. Can somebody please admit Alphonse de Souza? Because I'm seeing this name on my screen. Oh, I could do it.
It's already done, doctor.
Yeah.
I don't know. It was stuck on my screen. Okay, the symptoms. The main signs and symptoms of vitiligo is pigment loss that produces milky white patches, depigmentation on skin, premature whitening or graying of the hair on scalp, eyelashes, eyebrows, or beard, loss of color in mucous membranes that line in the inside of mouth. There is usually no other local symptom like itching or burning or irritation. And this is one of the most important aspect, that why it is incurable. because any condition that has associated symptoms, like we know in homeopathy, we have associated symptom, we have even the chief complaint, which we can categorize into location, sensation, modalities, concomitants. There are certain disease conditions where you may not have a detailed complete symptom like location, sensation, modalities, concomitant. You may not also have associated symptoms. This is one of the disease condition where there is no other symptom related to that particular part. And so it becomes difficult when the patient is not able to tell you the other symptoms of his mind or generalities. And so we do not get the symptoms that we need to prescribe on. And that is what makes it very difficult. Some of the pictures of vitiligo as seen in patients causes. It is not known why this occurs. Doctors and scientists have theories as to what causes vitiligo, but no definite cause has been found. It is linked with immune system disorder, heredity, sunburn, emotional distress, etc. Precipitating causes. So we may not have the exact cause, but there are possible causes that are known. One is physical trauma. Patients who are prone to vitiligo may develop vitiligo at the sites of traumatic injury. Exposed parts of the body which are liable to friction are the common sites where vitiligo may develop, like a persistent irritation by using tight clothing around the waist. So they will have a white discoloration in that particular area. And physical trauma is quite common when we see in vitiligo patients that after getting injured, the scab which is formed, the scab falls off and there is a white spot remaining. So this is quite a common presentation that we can have. Sunburn, prolonged exposure under strong sunlight can also cause the depigmentation. Emotional upsets, sudden mental shock, disappointed love, persistent worries and anxieties, death in family, loss of job, etc., which are the present days most common problems that we see around us. Now, here I'll give you an example of one of my patient who had vitiligo on scalp, on chest, nape of neck, limbs, and it developed only within 2 days. The only history that I've heard in all these years of my practice, that somebody developing vitiligo in 2 days, and that too in such a large proportion on different parts of the body. His history was, he was a manager in a credit union bank, and he had given overdraft to one of his customer on his own responsibility and guarantee from the credit union committee. That person could not pay the amount. And so the patient was to pay this money to the bank, and he did not have the money to pay. This was constant stress on his mind because it was his responsibility to give money back. And he approached this customer of his many times, but he bluntly declined that I don't have money, I cannot give you. So this was constantly there on his mind with all the emotions that he may have gone through. And he could manage paying to the bank, but due to this stress, suddenly in 2 days, he developed white discoloration on body. Since then, the discoloration has been constant, no increase and no decrease. Other precipitating causes, excessive smoking, use of cosmetics. Family history of vitiligo may be seen in about 50% of cases. Why 50%? We as homeopaths, we say that it is normally heredity in origin. but sometimes the other 50% of cases may not even know that they have a family history, like somebody in the family has vitiligo. So that is why here we have mentioned 50%, but normally it is more than 50%. Gastrointestinal tract disorders like worms, jaundice, amoebiasis, this is also quite important cause for vitiligo. Normally not talked about too much in the medical literature. Prolonged use of drugs, antibiotics, oral and ovulating agents, etc. So these are also responsible for causing vitiligo. Local causes like burns, exposure to chemicals, etc. are also precipitating causes for vitiligo. Now there is something like secondary vitiligo. Vitiligo may appear in association with or secondary to many systemic diseases. In such cases, vitiligo itself is not the disease, but an associated manifestation of some other disease elsewhere. Some of the common systemic diseases related to vitiligo are Addison's disease, thyroiditis and thyroid carcinoma, hyperthyroidism, hypothyroidism, diabetes, malignant melanoma, pernicious anemia, psoriasis, alopecia areata, malignancy of skin, toxic and simple goiter. So you may find psoriasis, the vitiligo as a associated disease with all these diseases also. Now, what is the homeopathic viewpoint? What does Organon say in this regards? Vitiligo, as I spoke in the beginning, that it is a one-sided disease. So it is very common for us to find that this disease having no symptoms or very few symptoms. Hold on. Okay. In aphorism 80, in Organon, Hahnemann writes that the chronic miasm of psora, after the completion of the internal infection of the whole organism, announced by a peculiar cutaneous eruption, the monstrous internal chronic miasm, the psora, the only real fundamental cause and producer of all the other numerous, I may say innumerable forms of disease. So, we all know that psora is always there in the background. And when we are dealing with a condition like vitiligo, which is an autoimmune disease, then there are multiple miasms involved. So you may have a complex miasmatic presentation with these cases. Further, Hahnemann talks about local maladies in aphorism 185 to 210. And in 185, he says that among the one-sided disease, an important place is occupied by the so-called local maladies, by which term is signified those changes and ailments that appear on the external parts of the body. Till now, the idea prevalent in the schools was that these parts were alone morbidly affected and the rest of the body did not participate in the disease. In aphorism 189, he further says that no external malady can arise, persist, or even grow worse without some internal cause, without the cooperation of the whole organism, which is a very big statement, because this statement particularly makes it very clear for all of us that all external manifestations it is always related to some internal cause. And lastly, he says, which must consequently be in a disease state. That means the whole organism, like we saw in aphorism 80, where he announces that Sora is the fundamental cause, and after this Sora affects the whole system, then you see something external. So he says further, it could not make its appearance at all without the consent of the whole of the rest of the health. So when we say that there is an external manifestation, a small eruption, that means the body has allowed that eruption to be there. Otherwise, the eruption can never be there. And without the participation of the rest of the living whole. No eruption on the lips, no vitiligo can occur without previous and simultaneous internal ill health. In aphorism 90, he says, all true medical treatment of a disease on the external parts of the body must be directed against the whole, if it is wished that the treatment should be judicious, sure, efficacious, and radical. Now, the totality of local disease. When we form a totality in a case, then in local disease, what are the various points that we have to consider that Hahnemann says, which includes exact character of local affection. Here we have vitiligo, which is a patch which is depigmented. But in some other local affections, you may have a size, you have a shape, you have a particular look. And all these are important because when we go into the repertory, we'll find all these special size and shape and how the look of the area is, that all is mentioned so that we can take help of. Case taking as per aphorisms 83 to 104. So this is one part which we cannot miss. And all changes, sufferings and symptoms observed in the patient's health. So everything that we see in the patient's health is to be considered when we take the case. What do we take in the totality? It may be different, but at least we have to note down everything that the patient has in his health. Trace involvement of miasms. See what specific symptoms are belonging to what specific miasms. Symptoms noticed when no medicines were used. This is very important. In any condition, in any disease, we normally ask our patients that how was the complaint before you took any medicines? This is one of the questions which I normally put up to the patient so that we get an unadulterated picture of the problem. And that helps us in understanding that these were the symptoms which were before he took any medication, and these were the symptoms which were added to, maybe because of the side effects of the medicines that he had taken. And lastly, very important is obstacle to treatment. Because no matter what we do, if there are certain type of obstacles which can be constantly there, and which may prevent the relief to be there in the patient. So it can disturb the cure of the patient. Now, homeopathy does not consider vitiligo or any other skin condition as only local skin disease, which we already saw in the previous slides, but a systemic disorder having its chief manifestation on the skin. Vitiligo can present as a one-sided disease having its chief or only manifestation on the skin to start with. Homeopathy treats the person as a whole. That is, it treats the man in disease and not the disease in man. It means that homeopathic treatment focuses on the patient as a person, which includes his pathological condition. After a full individualizing examination and case analysis, evaluation, a constitutional medicine is decided, which also covers the miasm. This medicine then becomes the remedy to the case because it is the similimum medicine. When this constitutional medicine is supplemented by proper diet, lifestyle, hygienic measures, and removal of the possible obstacles, then in most cases, we may be able to cure. It must be remembered that melanization of the patches from where melanocytes have completely disappeared is a difficult task and requires a prolonged course of treatment and patience, both on the part of the patient and the physician. So I normally give a specific time frame to the patient, which helps the patient to be calm and relaxed and focused in treatment. Now, this is easy when the patient has come from an allopath or other system of medicine and he has said that this is incurable. This will remain till the end of your life. But when he comes afresh, like without going to other people, then he will not know the gravity of this situation. So we have to educate the patient in regards to the difficulty of treating this condition, and also tell him that this is, we don't know whether we'll be able to cure. This is, of course, we don't guarantee our patients anything, but still it is better to do that so that the patients know what they have and what efforts we are putting in. And when I say I give a specific time frame, this is also very important because patients, when they come to us, they ask, how much time will this problem take to go away? So my normal take is about 1 year to 3 years is a time frame which I give to my patients, that this is the time it may take. Sometimes it takes a longer time period depending on how the patient comes to us, in what condition. Because recently in last week, I saw one child who came from Ohio, USA, and this child had a recurrent, once he had on the right side, he had vitiligo, right side of the face and the neck. And the parents took him to the allopathic practitioners and they gave him cortisone applications and some light exposure. So first these spots went away and then they again recurred. He again went for this local application treatment. They again went away. Again the spots came up. So the problem now that we face is how will the case recover? So that was the question of the father, that how we will see relief. Now, we don't know how the relief will happen. Will the old spots which have been suppressed will come out and then they will go back? That is something which only time will say. So we cannot guarantee. We have to tell or educate the patients likewise. And usually the patients also ask us that since we have heard in homeopathy that when you give a remedy, the problem increases first and then it decreases. So if I am having this small spot, will this spot become this big or will I have more spots on the body before the complete cure takes place? These are some of the things which we have to be ready with in answers, and so that the patients are satisfied. And if the patient feels that you have been answering with confidence, then he will continue with you. Otherwise, there are chances of dropouts in the patients. So this is my experience that I have seen. Miasmatic diagnosis. Complete absence or destruction of melanocytes indicates a syphilitic miasmatic state and requires syphilitic medicines. This is very important. And in all my cases of vitiligo, syphilinum is one of the main prescription that I normally give. Cases where the function of the melanocytes is defective or there is some coordination in the body resulting in relative melanin deficiency is indicative of psychotic miasmatic state and may require related psychotic medicines. Secondary depigmentation during the course of an illness indicates a complex miasmatic situation where two or more than two miasms are involved and the treatment should be planned accordingly. Plan of treatment. First step is to select a constitutional medicine which covers the totality of the case, including the miasmatic background. Keep in mind the intercurrent medicines which can be of help. Take care of possible obstacles of precipitating factors. Vaccinosis must be antidoted as and when necessary during the course of treatment. This is very important. Vaccinosis, and this is one history which of late I have been asking my patients whether, and I've seen so many patients here in North America who have developed eczema or allergies post-vaccinations. And this is quite common because the amount of vaccines given to an infant is phenomenal. The amount of vaccines that were given in about 15 years back was very less. So you find a lot of immune system disorders or hypersensitive reactions seen in patients, especially small kids. And this we have observed even after people who have been vaccinated against COVID. Do not attempt to remove the patches of vitiligo by external local medicine. Please do not do it because one, it doesn't have its effect. Second, when the patches go away, if you still further go into the organon and see the local melodies, there Hahnemann clearly writes that if a local symptom, which is the only presenting feature of the disease, if it goes away, then you do not know whether the disease is cured or not. That means if it goes away by local application. When you are giving an internal medicine and then the problem goes away, then we can confidently say that your problem is cured. If it just goes away by local application, then we cannot confidently say, because there are chances that when the effect of that local application wears off, then the symptom may again come back. So do not try to do this. Do not give so-called specific therapeutic medicine if constitutional is available. This is again a very important point because therapeutic medicines are useful for temporary relief of the problem. They normally do not cure constitutionally the disease, and take care of diet and other hygienic precautions. Lemon, sour, fermented and citric acid containing foodstuffs are to be avoided as they may act as hindrance in the way of cure. This is specifically for vitiligo, that you have to avoid sour food. Avoidance of meat may expedite cure, though the reason is not yet clear. Avoidance of meat is normally common for any kind of skin condition, especially when it is of a type of autoimmune character, like psoriasis, like vitiligo. So avoidance of meat helps, and as is written here, how it helps, it is not known. Avoid pre-cooked and processed food. This is the advice we give to all the modern generation patients, that you try to eat cooked food which is cooked recently and try to eat fresh home cooked food rather than taking it out from outside. Use of cosmetics, especially the use of lipsticks, vermilion, etc., is to be avoided or restricted as a routine. Assure the patient that the disease is not incurable, not infectious or contagious, and not due to any sins. Prognosis. Homeopathically, prognosis is quite favorable. Complete cure may be possible in many cases, but it requires a prolonged course of treatment. The initial sign of improvement may take months to manifest, but once repigmentation starts, the progress of improvement may be very rapid. This is very important again, because as I said, I give a time frame to the patient, and this time frame I have given because in many of my cases, I have seen that this is normally how it goes. And I look for first repigmentation normally. When the first repigmentation happens, then I'm very happy, because then the repigmentation goes very fast and the cure is very fast. Some of the commonly used intercurrent medicines in treatment of vitiligo, they are syphilinum, basilinum, tuberculinum, thuja, Merxol, Nux vomica, bowel nosodes, carcinosin. Intercurrent miasmatic remedy. Syphilinum, since destruction of melanocytes is one of the cause for vitiligo, destruction points to syphilitic miasm, and so syphilinum is an important remedy to think of. Thuja, or thuya as we call it here. According to Burnett, thuja works as an antidote and clears the psychotic background after vaccinations. He says after 3 doses of thuja 200, the patient's general condition improves. Now is the time to give the indicated remedy which starts working well. Basilinum or tuberculinum. A past history or family history of tuberculosis or pleurisy or a history of chest disease is a positive indication for the use of these medicines. Basilinum is chilly, tuberculinum is hot. Normally, syphilinum and tuberculinum are 2 of my most favorite medicines to give to the patient, because tuberculinum, as you know, it is pseudosora, and pseudosora is a combination of a soric and the syphilitic miasm. So in tuberculinum, we have combination of both. Carcinosin, when there is a definite history of cancer in the patient's family. Bowel nosodes like Morgan-Batch, Morgan-Gardner, and Dicentrico can be used with good success. Nux vomica is required initially when the patient comes after taking a lot of modern drugs. It acts as an antidote to clear effects of allopathic medicines. Merxol is indicated in cases with a history of dysentery, with mucus and blood, jaundice, and liver enlargement. Ars sulflavum. This is the most abused prescription. Many doctors say that they are disappointed with the use of this remedy. Even I say that, because in many of my cases where I was not able to see a constitutional remedy, this was one of my favorite prescriptions. But in not a single case, I could see results after ars sulflavum. Kent says in his lesser writings that if one finds either mental, general, or sexual symptoms along with the white spots, the patient will definitely get well. Now, this is common with all the medicines. If we can find a mental or a general, then that remedy will definitely help have a positive effect on the patient. So it is not something new with ars sulflavum. Now a case. Male child, aged 4 years, was brought to me on 28th May 2012 with complaint of pale discoloration around eyes. Since February 2012, skin around eyes became dry with itching. First discoloration was noticed above left eye on eyelid, with itching. After 1 month, area below the right eye was affected. Angle of mouth also showed discoloration. There were no other associated complaints. Parents had shown the child to a dermatologist. He diagnosed it as vitiligo. He prescribed a cortisone cream to apply. Parents were not ready to apply the cream and thought of taking homeopathic treatment. I tried to communicate with the child, but he was shy to respond. On shaking hand with him, I noticed that his palm was moist with sweat. History was given by parents. Past history of frequent tonsillitis, The tonsils were big on examination, and he was advised surgery by the doctor. He had frequent cold, cough, and fever. He has had ear infection twice, for which he was given antibiotic. He is vaccinated. When parents were asked to tell more about him, they said he is very obedient, not of the crying type, eats everything, inclined to do homework soon on coming back from school, likes to go to park and play, can sleep anytime and wake up anytime without crying or any fuss. He likes going to school. He does not become angry or beat anyone. He takes care of parents when they are sick. He likes cars, toys. He's always excited to go out. He's always doing something. He does not sit idle, doing nothing. He is shy when someone tries to talk to him or when he has to reply. Appetite, he eats little at a time every 3 hours. He desires sweet, ice cream, chocolate, chips, foods common to kids. Aversion to sweets till 3 years of age. Thirst is present, more during sleep. Urine stool, nothing specific. Perspiration plus on scalp. Wetting the pillow, palms plus. Sleep sound, salivation during sleep, snoring. Thermal, he cannot bear cold, always want extra covering. His pictures on day 1 of visit. So you can see a very distinct patch on the left, above the left eye, a distinct patch on the below the right eye, and a faint patch which is developing over the right eye. This is another picture with eyes open. And you can see how clear the patch is. You can also see some white hairs like appearance. He also had a round patch on the left side of his head, the parietal area. And he also had some pale discoloration here on the angle of the mouth. Analysis of the case. This child gave me an impression that he is an ideal child. His behavior was very good and he was very nice with everyone. So that made me take the symptom of good boys described by Dr. Praful Vijaykar, in which he has included qualities like obedience, nice, diligent, conscientious. And the medicines he lists against this are hot remedies and chilly remedies. This child was a chilly patient. So the remedies which would be indicated would be aurum baryta carb, calcarea carb, carcinosin, ignatia, natrum carb, phosphoric acid, silicea, staphysaegria. This information is taken from the treasures of Dr. Praful Vijaykar. The prescribing totality: good boys, timidity, bashful, shyness, yielding disposition, timidity to talk in public, and chilly. Perspiration scalp, sleep during, perspiration palms. The medicine indicated was silicea. I'm sure many of you would have cracked this case. The important thing in vitiligo is, yes, finding the right remedy is definitely important, but managing the case throughout is also most important, which I will tell you later. So silicea 200, one dose was given on 28th May 2012. In June, the follow-up was slight better, skin turned pink, breathing sound has decreased, which he had snoring, if you remember. In follow-up, the parents said that they have white spots in the paternal great grandmother. There were white spots. Another important aspect in follow-up is this, which is normally missed out by parents or by patients. This child, after he was given silicea, he had an urge for stool for 1 week after the medicine. Only liquid stool passed, no weakness due to it, and no effect on daily routine. When we see a patient after 1 week, then this history can be elicited or can be received. But when we see a patient after 1 month which happens occasionally, then the patients don't remember this history. And this is one of the crucial histories of after giving a remedy. Any discharge from the body, anything of an abnormal character, which is not normally in the life of the patient, that is very important for us. This urge for stool itself was an indication to me that silicea is the right remedy in the patient. And this was the first reaction that the body gave after the medicine was given. And I've seen this in many of my cases in follow-ups, that if something like this happens, then the surety of the case getting cured becomes more surer. Next follow-up, November, he had complained of earache 1 to 2 times, aggravated at night. He has and had history of earaches whenever he had tonsillitis in past. This is again a very important point, because in most of my cases that I have treated, and especially in case of children, all these cases have had history of throat infections, earaches or ear infection. They have had a history of repeated cough, cold, flu-like symptoms, fever. All these were very common. And I have seen in these cases that when we try to treat these patients, there is a recurrence, or when we call it return of old symptoms. So these are very commonly seen, and this is what is important in managing these cases. In January 2013, in December, he had earache once. It was mild and did not need any treatment. This is again an important point. Does not need any treatment. When there is a return of old symptom, that return of old symptom normally does not need any treatment. It goes away by its own, because the effect of the medicine is still there. The immune system has been stimulated. So immune system itself will take care of the problem. What is our job is to reassure the parents or to reassure the patient that if this has come, this will go away, don't worry. And an advice that I give to all of my patients is, do not give paracetamol, do not give Tylenol that we give here, do not give Advil, do not give ibuprofen, do not give antibiotics. These are 5 things that I say you do not give. Why? Because when we say do not give any medicine, they only think antibiotics as medicine. They don't think that Tylenol, Advil, paracetamol, they are all also medicines. And here, whenever anybody goes to the doctor, normally the doctor says, take a Tylenol. So it has become a normal habit of patients to take Tylenol, even if there is a slight heaviness of the head, or if there is feverishness, or if there is a coryza, they take a Tylenol and they are good. So we have to tell them in every follow-up that please don't take this. And when they don't take this, and when there is anything like return of old symptom happening, and if they wait for a couple of days, then the problem settles on its own. And the most important thing is, when these return of old symptoms come, the melanization or repigmentation of the spots happens fast. So this is very much connected. And I always tell my patients and show it to them, see, your spots are becoming better when you had this throat infection last week or maybe 2 weeks back. So every time you have this problem, this will get better. So this is something which I feel that you may have to tell your patients very confidently. If the reappearance of symptom, if there is a cough, cold, coryza or a fever, if it does not get better in 1 or 2 days or 3 days, it doesn't go down, that means that it is probably a fresh infection which the patient has had, and you may have to treat it otherwise. So this also keep in mind. So in December, he had this, And since 2 months, no change noticed in skin. So Cilicia 1M 1 dose was given. In April, he is better over the eyes. One spot below the right eye remains. Spot over left eye decreased but steady. Spot on left temporal region gone. Discoloration on angle of the mouth is better. Did not become sick this winter, which he always used to, if you remember the history. So you see this spot which we saw is gone. This is reduced to the minimum. This has also reduced in size. It was extensive. Now, if you remember, he had first spot here, second spot here, and third spot here. So, you see the Herring's law, like the last spot which had appeared, it went first. The second last that appeared, it went next. And this will be the last to go away, which we will see later. So in September, follow-up much better than before in skin. In June 2014, he is better. He had coryza, dry cough in October, November due to weather, did not have fever, and all this lasted for about 2 to 3 days. He was not given any medicines for that. You see, this spot is almost very small. This is also very small. In March, cough, cold, 3 weeks back, prescription Tylenol. As I said, this is a habit. So even though we tell the patient again and again or the parents, they land up giving Tylenol. Pale spot on the left eye, upper, very thin line, no spot on the right eye, lower, no pale spot on left temporal region. This was the last I saw this patient because parents, they called in the mouth, angle of the mouth. We saw a white spot, a pale spot in the initial picture, but now it is absolutely gone. So the parents called to report that he is better and they will come for treatment if needed. So he had that small line, but I'm sure that it would have gone away considering the relief that he was getting. Another case. A 10-year-old girl was brought to me on 17th July 2015 with complaint of white discoloration around her genitalia and anus noticed since 1 year. He was diagnosed as vitiligo. There was itching in that area and the part had become red when it was noticed. She was prescribed local protopic ointment, which we all know, they are all immunosuppressants, and a cortisone cream since last 8 months. They have stopped these since about 15 days. There was no other complaint. Past history was, since last 3 years, she develops fever in the beginning of winter. First, she has cough. This is the way how it progresses. First, she has cough, plus. Then she becomes weak and tired. Fever comes and she is given antibiotic and a flu shot. So this happens every winter since 3 years. There is no history of any skin eruptions or diaper rash. Whenever there is an eruption in the genital area, diaper rash is very important to be asked about because diaper rash may sometimes finally result into depigmentation. Milestones normal, family history, heart disease, diabetes, hypertension, arthritis, throat cancer, breast cancer, eczema. Generalities, appetite average, nothing particular, desires non-veg plus, chicken plus, meat plus, warm food, ice cream, tasty food. Aversion, broccoli, tomatoes, onions, typical for children. Aversion to milk plus. Thirst is present. Thermal, chilly patient, urine and stool, nothing particular. Perspiration of scalp, palms and soles. Sleep, sound. Pain in calf at night, wants hard pressure on legs during sleep. Mind, easily irritated at trifles, easily angered, cranky, wants everything to be done according to her wish, fear of spider and dark, likes dancing. Prescribing totality, desires meat, aversion milk, chili patient, thirsty. Now for me, this patient, when I took the history, what was very characteristic which came to my mind was the excessive desire for meat in this child. I don't see that very common because I have patients who are also of coming from this East European countries or North American or Canadian as proper Canadians. But I don't see this much desire for meat. So for me, it was very characteristic, and especially coming from an Indian family, having this craving was more specific that came to my mind. Now we see the pictures. You see the discoloration, the white pigmentation. Around the anus also it is there, before and behind, anterior and posterior. For this patient, the prescription was mainly done with materia medica approach. As I told you, this is very important. What you feel in the patient when you take a case, I'm sure you all must have had this experience. In Kent, in this remedy, he writes inordinate appetite for meat in children. And in repertory, in generalities, if you see food and drinks, desire meat in children, the only remedy is MAC-carb. So MAC-carb 30, one dose was given on 17 July 2015, and patient was advised avoid meat, avoid fish. Very difficult. So we had to make some compromises that you may eat chicken sometimes or something like that. No local application of any medical creams were advised. No Tylenol, Advil, antibiotics without my permission. Report any health problem ASAP. Follow-up. In August, she developed high-grade fever since 2 days with pain in throat, pain abdomen, headache. Wants the head to be pressed. On examination, throat was clear. Throat not sensitive or painful on pressure from outside. Abdomen was painful on pressure in general, no specific area. Parents had given Tylenol for high fever. So this is common. Patient afebrile at present because Tylenol was already given and the patient was brought to me. On auscultation, chest was clear, no abnormal sounds, air entry good on both sides. Patient desired to remain in bed. She was active and playful, thirstless, chilly, no weeping. History of throat pain in last summer. Treatment was antibiotic. So the question was what to do. Is this a separate acute attack or is this a return of old symptom? Do I give her a medicine, maybe an acute, or take care of present symptom, or wait and watch? This was in my mind. Looking at her general condition, I concluded that the effect is more superficial and can be observed for next 2 days. She was already given Tylenol, so maybe that has relieved. I did not want to disturb the action of the medicine. With such acutes, also I try to communicate, or I make the patients communicate with me, if possible, twice a day. And if the problem is more acute, then more often. So if the patients don't communicate, I call them or I text them to ask how they are doing. And this is very important because when we communicate with the patient, when they are in an acute state, they are not in front of you, they are at home. So to give them confidence more often is necessary. Otherwise, when they have their complaints more, they tend to take some medicine, which is not what we want. So communicating with the patient in their acutes is extremely important, and never forget that part. So the parents were asked to report about her health morning and evening for next 2 days. In such situations, if the condition demands and if I don't want to disturb the action of the remedy, I take help of tissue salts like ferrum phos, kalimor, etc. Next day, fever less, pain decreased but present. Next day, better in all complaints. In October, there is some change noticed in the spots as reported by parents. In November, there was no major change noticed in the discoloration, so a nosode was thought of as an intercurrent prescription. Cifilinum 1M, 1 dose was given. In December, since 2 days she has pain in throat, abdomen, it started with a runny nose, followed by headache, followed by pain around umbilicus. She did not feel feverish. She was active, playful. There was no obstruction of nose. No Tylenol was given. Discoloration improving behind the anus. So you see in the initial pictures, it was very bright, white. Now it is turning to brownish. And here also, the cure that I saw came from posterior of the anus to anterior of the anus. So again, sort of a Herring's law. In February, better in discoloration, now anterior to anus, also shows sign of repigmentation. Pain in legs at night, wants them to be pressed. This looks like growing pains. So she was given Calcarea phos 6x. In September of 2016, discoloration 90% better. She is less cranky now. She drinks milk now. Appetite improved. And you see the spots. They are all gone. Pictures in December of 2016. No vitiligo patch. The learning in this case and in the previous case, there was recovery from posterior of anus to anterior side, which may be said to be according to Herring's law. Every time there was some sort of acute coming on, there was positive change happening in discoloration. This is very important, and always keep this in mind when you are treating vitiligo cases. So we can say that every acute is relieving the vitality of the patient from whatever block there is, so the vital force is able to proceed towards cure. Another case. I will go rapidly through this case. This is an ongoing case of mine, and this case was little tough in comparison to the previous 2 cases, because I had to retake the case of this patient about 2 to 3 times. But almost all the times, the history that was derived was the same kind, with some additional points, of course, which made a change in the prescription. So it is not a cured case, but the relief has already started. So I'm presuming that in next 6 to 8 months, probably this case will totally get cured. So this was a male child aged 8 years, came on February 2021 with complaint of vitiligo patches on feet, knee, elbow, back, fingers. The history was that few years back on beach, they went on a beach. There was a smooth patch on right side of cheek. Then they went to Dominican Republic, and there the spot disappeared. It is 2 years now, and the prescription they were given was protopic and steroid cream. First spot had come in summer 3 years back. Very hot day on the right side of face. In first year on dorsum of foot, ankle, fingers, back, on sides of thigh. Now they applied cortisone creams. So the old spots, they went away, and the spots which we see now are the ones which are remaining. There is a family history of vitiligo in father since 20 years. He had a small spot, remained as it is. A history of vitiligo in paternal cousin. Other family history: diabetes, high blood pressure, heart disease, kidney problem. Past history of diarrhea for 3 weeks at 1 year age, diagnosed E. coli infection. Bad cold, pneumonia in winter of 2019, but he already had vitiligo before 2019. So not of great importance for us, but then even then we have to consider. Fever, throat infection, ear infection. At 1 year age, every few months he had it, and the treatment given was antibiotics. So again, in this case, you find the same fever, throat infection, ear infection. Once a year has fever, cold, cough, throat, and ear infection in fall or in winter. That means between September to March. Treatment was always antibiotics. He's a very happy, playful kid, loves to play and have fun. He's a bit picky eater, gets mad, frustrated easily. He is a leader type and wants others to follow. He runs and plays in park. He becomes angry with red eyes when contradicted. He will be upset, yell, scream, pull his hair. He can easily get frustrated from contradiction, or if he can't do something, he will cry, pull his hair, show with feasted hands that he is angry. He'll do this. Will have facial expressions of anger. There is no complaint from school about this anger. So he's very good. He's a very good kid at school, one of the best. But at home, with his family, with his friends, he is like this. So we'll see his spots. So this is feet, the left foot, dorsum, the right foot, again dorsum, the right foot on the ankle. These are elbows. This is knee. This is the back. So this was in February 2021. Now what happened with him? That for almost until April, I think, of this year, there was no relief, 2023. So the mother was very anxious that when will the relief start? And I was not getting the right constitutional simillimum for him. So that is one of the reasons why I had to retake the case. I retook the case in December 2021, then again repeated in April of 2022. And based on this, he was given various medicines like stramonium, lycopodium, tuberculinum, syphilinum. In August, the spots became more prominent. So the spots increased a little in size. They became more prominent also. And that was also a concern. Concern of parents, of course, yes. But concern of me also, because this is not responding. So I was also worried. Knee, there was only one spot. Now the spots increased and both the knees have spots. This was November 2021. This was again November 2021. No result. Some spots increased in size and prominence. Recase taking was done in December 2021. And he had almost the same set of symptoms came, but there was slight change at some point. Naxwamika was given after that. My screen is getting... This was April 2022. You can see the prominence of all the spots and they have become more. So with his follow-up history, there were certain things which were important. Every time he came to me, he was slightly shy. This I had noticed from beginning, but somehow I did not give importance to that, which was my mistake. So a totality of dictatorial jealousy, sensitive to criticism came later on. I did not know about this sensitive to criticism, but then mother said in subsequent follow-ups or in the last follow-up that he's very affected, that if somebody says that your clothes look like this or you look like this, he cannot take that criticism. He is very sensitive to it. He's timid, that from the beginning he had this. Jesting, he could not take a joke, like he would fight with his friends or even with the family if they make a joke on him. Anger, contradiction was there from beginning, dictatorial was there from beginning, jealousy was there from beginning. So based on that, prominent medicines were murk, sulfur and natrum. So I thought that he's more of an aggressive kind. So I gave him mercurius. And the spots started gradually filling up. So when I say gradually filling up, means you'll see these spots having a slight change here. Gradually, you will see. But on the other side, he also started having a recurrence of old symptoms. Like he started having cough colds, he started having fever. And so if you see this, the elbow spots from above downwards, if we talk, the elbow spot started becoming better. Even the knee, this spot almost fainted, gone away. And you will see that these margins are have started becoming, sorry, when I'm touching the mouse, brightness goes down. So it is absolutely spotless here. It is almost spotless here, but you see the margins are becoming little more, you see repigmentation and some dots appearing on this, which is a positive sign. And this is a sign which we have to be constantly on a look for. You see this spot was absolutely spotless, but here now you see the spots coming in. The margin is more, now you see repigmentation and the spots, one spot coming here, which is again a positive indication. If you see, the margins are also becoming now like it is shallow pigmentation. So that is a good sign. The elbows in August are almost going away. This spot is not there. The knee spot have reduced in size. And this is also showing on the margins. You will see this shallowness of brightness and shallowness of repigmentation. So that is the merging of the new spots coming in. This is for October. The elbow is like this. And the spot here, there are more spots coming in. And this is a positive sign. So, and he also had some sickness like fever and cough cold in October also. But the most important thing here is all these fever and cough colds that he is having, they are going away on its own. So he is on placebo, obviously. And another thing that I normally advise my patients is whenever they have an acute, what happens? I ask them to take a glass of 100 ml of water. And in that 100 ml of water, I ask them to put about 9 or 10 pills in the globules in that water and dissolve it. And take this water every half an hour, 1 hour, depending on how intense the problem is. So when the patients do that, they feel that they are taking some medicine, and they also that takes away our time. It buys us time, and by the time that glass gets over, it makes a new one. The problems start getting better and better. So they feel the medicine is working, but we know that it is not this placebo which is working ideally. Of course, psychologically, it is placebo which is working, but the patient, his acutes go away. And that is very important for us. So as I have been saying, learning from the cases is I have observed return of old symptoms or a discharge develop after giving acebelimum. This discharge produced maybe a very little or slight change in regular habits. For example, passing loose stool for 1 day or going for urine more frequently for 2 days or one vomit, etc. These are many times overlooked by patients and not reported, and the effect of medicine is not seen to have started. And I have seen these to happen usually in first 3 days of giving the remedy. So now I always ask my patients, how are you in first 3 days of taking the remedy? And many times, if we get any of these symptoms of return or an exteriorization or a discharge coming in, then I'm more confident of the remedy that I have given. When there is an acute condition developing after giving the remedy, never prescribe another remedy unless you are very sure that it has no connection with the history of the patient. So if it is a fresh infection, then you can probably look into that. Wait and watch for few hours or couple of days is very important before taking any action. Follow up in these hours is very important. If patient does not follow up, we have to call or ask how he or she is doing. If you are tempted to give a remedy, then remember second prescription. Second prescription has the first thing is stage of no interference. And the second point is stage of interference. When we interfere, then the first point is same remedy in same potency. The second point is same remedy in higher potency. And the third point is or some other remedy which is complementary or which follows well. So remember this when we are treating these cases. From these cases and from practice, I have learned that homeopathic medicines can cure disease even if labeled as incurable by others. Single medicine can cure the disease. No matter what approach is taken, a similimum always gives results. Never say no to any patient simply by hearing the name of disease. Homeopathy can always help any patient having any disease in some way. There is exteriorization of disease in some way when a similimum is given in most of the cases, and we have to manage this exteriorization with caution. If it is understood and managed properly, then cure is almost achieved. Document before and after results of the case to understand the process of cure and management of disease and share the experience with others. I always take pictures of my patients who have any skin conditions on the first day, and I repeat taking pictures maybe every bi-weekly or monthly. Always do that with your patients. That is the only clue of what was there before and what is there after. Patients will forget, your eyes, your mind will forget how much large the spot was or how big was the eruption. So always take a picture and document your cases. Thank you.
Thank you.
I hope.
Thank you.
Yes.
Thank you, Dr. Akshay. It was excellent session. Really wonderful. It gives us a very good confidence of this type of difficult cases. For me, it is really difficult cases. And you also gave us how to build up the patience in us, in the both the side, actually.
Yes, it is very important because these are the difficulties which I went through when I was treating. So there were many cases which maybe which went away from me. They did not continue treatment, and I understood why they did not continue. See, confidence in the patient, in the doctor, is something that the patient looks for. Patient will not like to go to a doctor who is not confident. So we have to be confident, and we are only confident if we know how the process will happen. If we are not confident, then it is very difficult. So I have gone through that, and I wish that you all don't go through that if you are faced with such cases. So
Yes,
I wish everyone all the success. Any questions do we have?
Yeah, we have one question from Dr. Manjari. She says about how sour foods are a hindrance for cure.
It is very difficult. It has not been known clinically, not known like scientifically. But this avoidance of sour food probably has come from the Ayurvedic literature, that they normally advise that no sour things are to be used, because considering sour food produces acid in the body, and acid or having an acidity, or if the body metabolism is more acidic, then the chances of skin conditions become worse. So, and it is known scientifically now that if the body is made alkaline, then alkalinity will reduce the inflammatory process, and thus it will relieve many of the diseases which are based on inflammations. And since we know, we have studied in pathology that any disease that it starts with an inflammatory change, and then inflammation goes into induration goes into the further disease process. So the base of any disease mostly is inflammation. And so it is necessary to, and that is why we have those alkaline products, water products available, that you make your water alkaline, drink alkaline water. It is very helpful. So this is where it comes from, I think.
It's good. And there is one from my side, one question is about in Ayurvedic also they are avoiding cross food, kind of you can't eat milk and garlic
Yes,
and milk, onion, or
correct.
is it, you have any experience for that?
No, I don't have experience, but I've seen these kinds of vitiligo cases happen in patients who normally do that type of food practices. But this is only an observation.
Okay, because they usually stop so many food items and
Yeah,
not try
especially
patient to eat the
milk
cross.
with garlic, milk with onions, milk with fruits is something that Ayurveda says no to.
Yeah. So thank you, doctor. Someone wants to have another slide for that secondary prescription. They want to check that slide again about the second prescription.
Oh, second prescription. Okay. Let me show it to you. Okay. Yeah, second prescription is very important for us. Yes, this is what it is. Second prescription, the last paragraph.
Yes. Okay, there is one another question also, that doctor, vitamin D supplements needs to be taken in vitiligo cases by Dr. Benzer. She is asking about is any vitamin D supplement has any kind of
I don't advise.
support?
I don't advise. That is not one of my advice to the patient. But here in North America, because the sunlight is very less and there is exposure is also very less, it is said that many people have vitamin D deficiency. So I always tell my patients that it is better you have it examined. If you have a deficiency, then you take a supplement. Don't take supplements just blindly that because it is North America, you need to take. It is not necessary to
Or
do
any
that. No supplements. I don't
any
advise any
exposure to sun?
supplements. Any exposure
Are
to
you
sun?
advising to?
I haven't done that. But if they come with that idea, then I don't say no to it. As far as the idea should be safe. And I normally I am not a favorite for giving supplements or advising supplements, because I believe that our body is capable of producing or manufacturing all these vitamins and minerals, even though It is said that the food that we eat, the vegetables have a lot of pesticides and insecticides. They don't have any nutritional value, but it is not like that. Our body is, it is the biggest structure or the most efficient structure that we have on this planet.
Yeah,
it is most
intelligent.
efficient. It can produce anything. So only thing necessary is a healthy lifestyle, proper sleeping, sleep for 8 hours, eat proper food, and do some exercise. These three are the basics of getting better.
Mostly children develops after the throat infection or antibiotic. Have you observed that things? Means mostly the children are having throat infection, and then they after that they are developing this after taking antibiotics, and then they develop these cases.
Vitiligo, you mean?
Yeah, specifically vitiligo.
Not immediate. I have come to
Not
this conclusion after seeing that there is a return of old symptom. And now I tell my patients, or if it is a child, the parents, that this is going to happen. So no matter what, if you want this thing to go away, you'll have to allow the cough, cold, fever to come and to go away without Tylenol. Here now another habit that I have developed is that if a child is having fever and if it is a night time, then I advise that at night before you go to bed, you give a Tylenol or a paracetamol to the child if there is fever. Because here what happens, the parents are sleeping in one bedroom, child is sleeping in another room. So there is no constant watch. In India, what was happening, the child used to sleep between the parents. So they were constantly aware whether the fever is going high or low. But here it is a difficulty. And we don't want the fever to go high during sleep and cause another disturbance to the child. So that is one of the reason I say that at night, if the fever is there, you give a Tylenol or a paracetamol, and then we will see during the daytime what happens.
Okay.
So this is another change that I have had because of experiences.
Before sleep only. Okay. Dr. Rajasri is asking, what remedy was given to that bank manager? Any rubrics taken like that? She's asking of that bank manager. Case of that bank manager.
Which bank manager? Sorry, I only treated. I showed you 3 cases of children.
First case.
First case.
Oh, the first case was Cilicia. First case was Cilicia.
No, while you were explaining the vitiligo initially, you said that there was this manager in the bank and he overnight within 2 days.
Credit manager.
This manager, this
2 days.
sorry, yeah, I understood now. This manager, I could not treat him properly because he did not want to pay me for my consultation. So I still
That's
wish.
why he's credit manager.
I still wish at the back of my mind, I still have a feeling that if I see him, I would be the most happy person to cure him of his problem. But somehow, maybe the God does not want me to do that. Yes. But that was a very interesting case. And I was so much happy that I have this strong symptom. And maybe if I give according to that symptom, he will get cured. But he did not want to pay me. So I said, okay.
Dr. Halloween asking about meat evidence and why meat is not any kind of scientific.
No, but I have been teaching in the college. I teach immunology, cancer, and all on these conditions I talk about. And when I go into the literature of homeopathy, then I find that there were many homeopaths who have said that for autoimmune diseases and for diseases like psoriasis, like cancer, like vitiligo, if the meat is avoided from the diet, then the cure of those diseases are more easy. Now, this is again
Faster.
observation, and if you go into the literature, you'll find that one of the most famous doctor was Arthur Hill Grimmer, who has probably, he is the only homeopath who has maximum number of cancer cases cured by him. So he has said this. Then Dr. Cooper said this. Then there are two more whom I don't remember the name. They have specifically said that when we avoided this from the diet, the curative rate increased a lot. So I think that is where it comes from.
Maybe. Yeah,
And
diet is the
even
most
if you see the modern medicine doctors, those who deal with diet and treating the disease, they will also say that it has to be a animal product free diet.
Yeah.
So that is gradually coming up.
Dr. Preeti is in front of us. She's
Yeah.
preaching on the base of diet. So I think she's a live
Yeah.
example for us.
Who?
Dr. Preeti only. She's, I think,
Oh,
following a lot on the diet. So
Yeah.
Okay, very nice.
she's doing a lot of
Yes,
research.
because here I am not advised to give medicine, so I'm giving diet food as a medicine, and I have done that, functional medicine course, so that I'm
that
treating
is
with that.
excellent. That is
That's
excellent.
right.
And there are so many diet-based doctors here in North America. So many, and they give good advice.
They connect a diet as a cross. For example, there is a cross immune reaction happens when there is a some throat infection has occurred, leading to the gut, and then autoimmune disease starts. That is the main connection they are looking, because gut healthy bacteria goes away and that antibiotics kills all the, and then the autoimmune thing starts. That is the connection.
That is, yes, there is very strong connection.
Dr. Banker, I wanted to know another thing is about physical injury where the skin cells get into the bloodstream due to physical injury like abrasion, etc. Does that cause an autoimmune reaction to melanocytes and then vitiligo develops?
I am not sure about it, but if I can tell you, see, our body is capable of digesting various stuff. And if we are speaking specifically of this, then only if the patient has a tendency to develop disease. Don't forget the honeyman in Organon. Sora, syphilitic miasm, or a tubercular miasm has to be active in order to produce a disease.
So the
susceptibility is very important. So I will not go into that, because I will not go into the pathology and whether these cells are able to produce. We all have been injured right from the childhood at some point. But this injury does not produce any disease in us of that kind. It only produces disease in people who are susceptible to it.
Yes.
So technically speaking, no, it doesn't. These cells, they do not produce.
Thank you, doctor.
Welcome.
Thank you. Any other questions?
I think there are questions from Dr. Rashmi and Dr. Bibi Fatima. I think 2 questions are there.
Yeah, what is your experience? Do you have any experience with lanthanides? Because lanthanides also are used in autoimmune disorders.
Experience with lanthanides.
Okay. And what about widespread vitiligo? You know, there are quite a few patients who had full, like vitiligo universalis, for example, you know, and they come. Any experience in those?
I'll give you an interesting case I was treating. One patient had come for neck pain. She had a very severe neck pain where every morning she would get up with a severe pain in the neck, pain in the head, and not able to function properly. So she had also had baldness of the scalp. So she came to me for both these two problems. And with medicine, she was like you said, she was totally white from head to foot. And her original skin was the typical Indian brown color skin. So when I started treating her, this neck problem started getting better. She also started having brown pigments on her face and nose. And her hairs definitely started growing, and she had full grown hairs. She took treatment from me for about 1 year, and she was much better. So she discontinued after that. And after 1.5 years, she came back again to me about 3 weeks back with redness of the face. Like there was red erythema with a lot of crusty formation on the face, and the neck was also red. So she was I gave her APs, and that relieved all the problems. But the important point is that she started developing the discoloration. That means repigmentation started again in her body. And all the hairs, they were all gray. They were all gray in the beginning when they came 1 year back, when the hairs came back. But now when she came back to me, half of her hair were black.
Wow.
So the repigmentation happens. The reason
the
why
right constitutional.
Yes. So the reason why I was saying in my slides that the body is capable of curing itself. What we need to do is to stimulate at the right point. If that we can do, no matter if the whole body has become vitiligo, it can again go back into that. She was laughing to me, and she was saying I was better with the white skin. Why am I getting the black spots now, brown spots now? But that is how her body, her immune system may have been treated with the previous homeopathic treatment. It may have stimulated that process of repigmentation. But because she did not continue with me, the pigmentation did not progress that fast.
Thank you.
So after Silesia 200, you directly went to Silesia 1M 1 dose, right? After a gap. You did not repeat 200 again, I mean, as per the rule of second prescription?
No, because I saw that 200 worked. So this is one thing which is again interesting. If you are interested in reading the literature, go to, again, Arthur Hale Grimmer. If you see the cancer cases that he treated, what he used to do, he used to give 30 potency first to the patient of the indicated medicine. And he says that if the 30 potency worked, can you imagine, he used to give 50 m as a second prescription. Right from 30 to 50 m. It was mind-boggling for me when I was reading his cases. But if you see a result of 1 potency, ideally we go. But when does a second prescription come? Second prescription is the prescription when the first one has not acted. That is the first line. Here, Silesia 30 acted. Silesia 200 acted better than 30. So the action was still already established. Now I don't have to worry about second prescription. I can simply jump to the higher potency and see the results better. Right. So the basic criteria of second prescription is, if it is not working, then we have to have different thoughts. And these are the precautions which Dr. Kent and other homeopaths gave to us, that when you have a problem after giving a first prescription, this is what you have to look for. Otherwise, it is not needed.
So confirmation is already started up with the 30 potency. So we are confirmed with the medicine, and then we jump to the higher potency.
Then we jump, because if the patient shows positive response, then you can jump. If the patient is not showing a response for some time, you can jump to the next potency, because you know the remedy is right. Now, only thing that is needed is a potency.
Yeah. And I like that things about discharge thing you explained in follow-up. That also confirms that
Yes,
should be
yes, yes.
considered in the confirming the medicine.
Yes,
The
it is very
various
important.
type of discharge. Yeah.
Yeah. Very important. With my last case, I did not see any return of old symptom for almost 2 years. So that was my concern. Spots not going away was not my concern as much. But he is not showing a response to the remedy. That means my remedy is not touching his immune system, his vital force. That was my concern.
Yeah. Dr. Banker, I wanted to know, instead of giving Calcarea Phos 6x for the growing pains, couldn't you have given him a potentized dose of, say, 30 or 200?
No, because she was already on a remedy which was acting. Then why give a remedy which interferes?
But then the growing pains wouldn't have it responded to that itself.
The same remedy, right? Same remedy you're saying.
If you read tissue remedies, there are only 2 medicines mentioned specifically to treat vitiligo. One is Calcarea Phos and second is Natramur. So when I gave Calcarea Phos, I gave with that idea that it will also help in vitiligo.
So could it be the Calcarea Phos success that was causing so much of improvement then?
I don't know. These are probabilities.
Yes.
Doctor, I just want to ask, your second case, you had given magnesium mure and then followed it up with syphilinum. Macarb and then gone with syphilinum. So
yes.
the nosode had helped to give a big relief in that case, isn't it?
That is why nosodes are given. They are given as anti-miasmatic remedies. They are intercurrent remedies. They will remove the block. Like magnesium carb 200 was given. If magnesium carb, since it was the constitutional remedy, it would have produced a relief, then the relief stops. When the relief stops for some time, then we give an intercurrent remedy, so that considering there is probably a miasmatic block which is not allowing the remedy to work. So when we give a miasmatic remedy or an intercurrent remedy, then the same remedy, you will see that there is progress. But this progress is not because of the intercurrent remedy. It is the progress which was already established, but it was halted because of a wall over there. We simply removed that wall and the same remedy worked further. In some cases, I would have given 1M after giving the intercurrent remedy. If I don't see any progress happening.
Have to repeat your Macarb afterwards, after the syphilinum?
Not too much, no. These were all maybe 2 doses or 3 doses at a time.
Okay. There are some practitioners who just start away with an intercurrent, like a nosode.
That is okay.
Like this, they do with a start dose of syphilinum. In a case of a vitiligo, first thing they do is they do a syphilinum 1 dose and then go with, after that they work on the constitution.
Nothing wrong in doing that also. Because if you are not able to find a syphilinum, then what you will do? If we are not able to get the right remedy, then it is better we give an intercurrent, so that at least something will happen in the patient. So nothing wrong in doing that also. It is okay.
And the difference about meat, craving meat to such an extent, and now Calcarea Phos has craving for smoked meat, right?
Oh, yes.
So, even I was thinking of Calcarea.
Good correlation. Thank you for the correlation.
Even I was thinking Calcarea.
That was nice.
Good. Thank you. Yeah. Very interesting cases, doctor. Thank you so much. And from before and after the progression and your follow-up pictures, excellent learning. Thank you very much, doctor.
Thank you very much. I'm happy that
very logically put up. Very happy.
Yes.
Thank you.
Very simple.
And Very
Yes,
simple.
homeopathy is
Doctor,
simple. We
Thank
make
you.
it complicated.
Bibi Fatima, I think she asked a question. Do we need to ask that or it's done?
It's
I'm
the same
sorry,
as
what was
meat.
that?
Same thing,
Same
no?
Which
Same.
one?
Okay.
Same as egg and meat, right? Yeah, it's same.
Okay.
Hmm.
So you can just
Uh,
point
sir,
out this issue.
can this, I have one question, please. This is regarding that you said there are two or more miasms involved. So can you just illustrate what is that it mean? Two miasm
See,
involved?
when I say two miasms involved, that means when patients come to us with such kinds of diseases, especially long-standing diseases, then we have found that there are layers of problems in the patient. Means you give one remedy and the layer goes away, and then there is symptoms for the second remedy. So the first remedy is not the same still which can be given, because the presenting symptoms, the presenting totality changes. And when presenting totality changes, the remedy also changes. So similarly, you will find that in one patient, the patient has a complex disease. He has 2 or 3 types of chronic diseases in the patient. When he has 2 or 3 types, means he is also he's also showing the syphilitic symptoms. He is also showing tubercular symptoms. He may also show psychotic symptoms. That is where the complex disease comes. So when you read Organon, you will see in classification of disease, you will find Hahnemann classifying disease as individual miasms. Then he'll talk about complex miasms. When we look at complex miasms, that means 2 or 3 miasms are already involved in the case. When we are treating a case of an autoimmune disease as like what we saw today, then it is likely that at one point, if I give syphilinum, it works well. But at other point in the course of treatment, that same syphilinum may not work. I may have to give tubercular, or I may have to give a psychotic remedy, because at that point of time, the tubercular miasm is more in predominance, not the syphilitic miasm, or not the psychotic miasm. So we have to give a tubercular remedy or a tuberculinum, so that this particular phase of the patient gets better. And then when that layer goes away, one more layer is there, because you are treating a chronic disease. So you'll find patients being treated in layers. And that is where you'll find different miasms come into place. If you are treating an ulcer will go into ulcer being a syphilitic miasm. When you treat that, it will go into a next stage, which can be a psychotic. Because according to Dr. Praful Vijaykar also, you will see that the disease goes from psora to psychosis, psychosis to syphilis. So when he comes to us in the syphilitic state, you treat syphilis, but then he will land into psychosis. And when you treat psychosis, he will land into psora. So this is the complexity of miasms which you are looking at. And the prescriptions may change depending on at what stage the patient is in.
Correct.
If that is...
Yeah, it's clear that it's a
Okay.
mixed miasms, and the old symptoms may come again, and we get another picture, and we have to
Yes.
take another miasm accordingly. Yeah.
Yes. But be
Thank you so
careful
much.
be careful before you change the remedy. Remember second prescription.
Very often, if the constitutional is right and from syphilis has come to psychosis, okay, you don't need to change at all, because it will come down to psora with the same remedy.
Very true.
Yeah,
Because
correct.
that remedy could be tri-miasmatic.
Yes, of course. So you may not need a separate anti-miasmatic remedy, because that constitutional itself covers everything.
True.
Very true.
Okay. Thank you so much, sir. Right.
Okay, so thank you very much, everyone.
Doctor, I have a question, a very simple question.
Yes.
I'm Dr. Deepak from Oman, Muscat.
Hello, Dr. Deepak.
Yeah, hi. So we have innumerable cases of leukoderma in Oman and in UAE also, in Middle East. I want to ask you, we always, all of us, we present our cured case or cases. Like vitiligo, I have treated innumerable number of cases. with multiple different approaches, results are very encouraging. I just want to ask you a simple question.
Yes.
What is the percentage of result you see in vitiligo cases?
If the patient follows my instructions, 2, if they stay with me for the time period that I advise them to, then I feel the chances of vitiligo patients, if you ask me percentage wise, would be more than 80. But
Here,
they have to stick with me.
Yeah, here, the biggest challenge which we are facing, doctor, I would say my own personal experience, the result percentage of my patient is anywhere from 50 to 60% only because of non-compliance.
That is why I said those 2 points were very important.
Yeah. So
And
mainly
only then you will see results. Otherwise, you cannot see results. If patients don't come to you, if they don't follow your instructions, how can you see results?
And one more question I have, doctor, for our young homeopaths in the group. When we talk of vitiligo or any disease per se, but here since we are discussing vitiligo, have you got any experience with pathospecific medications like arsal flavors or arsal brewer?
I already told that I have not had any results of ASF or ASR.
Right.
No.
Thank you.
It is, for me, I think it is the most abused prescription.
Yeah. Usually when you see prescription, patients are bringing prescription, that is what you see written in almost every prescription.
Yes.
Thank you, doctor.
Thank you.
Shall we conclude?
Thank you.
Yes, I think.
Yeah. Okay.
I want to express my sincere gratitude to Dr. Akshay Banker for his enlightening presentation. The knowledge shared and insights gained during the webinar was undoubtedly have a positive impact on our clinical practice. Let us carry the simplicity of homeopathy in our hearts, and as we continue our professional journeys, always striving to provide the best care possible. I thank Dr. Preeti for introducing Dr. Akshay to our group and moderating this webinar for us. Thank you all for your presence and active participation, which made this webinar a resounding success. Thank you. I think Dr. Ritu will just do a concluding message and then we can wind up.
Thank you, Dr. Banker and Dr. Preeti, Dr. Sita, all of you, and all the participants who took out their time to be part of this webinar of great learning. I really appreciate how Dr. Banker could explain to us so simply about vitiligo and taking us back to college days, focusing on Herring's law of cure, the role of intercurrent remedies, and importance of second prescription as well. So with that, I thank everyone and on behalf of Homeopathy Middle East, and I would just like to make few announcements for next month. As always, we will carry on with our case discussion on the first Wednesday of next month. And second thing would be, we will not be having any webinar, but an IHMA national conference on 21st November 23 at Park Regis, Dubai, known as IRIS, Integrative Pediatric Conference, which is basically organized by IHMA. So we would all be part of that, and wish you good luck, all of you, and thank you once again. We wind up the session with that. Thank you all.
Thank you.
Thank you very much.
All right.
Thank
Thank you.